Hello, Ms. Diver. My name is Nathan Powers. I'll be your student physical therapist assistant. How are you doing today?
I'm good, how are you?
I'm doing good, thank you. So it looks like you're coming in. It looks like you've been having some chronic headaches. Is that correct?
Yes.
All right. So I'm gonna have to ask you a few questions before we get started on our treatment today. On a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain, like send you to the emergency room, where would you rate your pain whenever you get these headaches?
It's like a 7.
A 7? Okay. And are you experiencing one of these right now?
At this moment, no.
Alright, good. I'm gonna be writing things down as we go, okay?
Okay.
Alright. And so, how long do these headache episodes typically last?
Like 2 hours.
2 hours? And they normally go away? Okay. And do you take any medication to deal with the pain whenever you get these headaches?
If I'm trying to do something, I'll take like a Tylenol or ibuprofen, but I usually try to just avoid taking medication.
Okay. Sounds good. Okay. And whenever you're getting these headaches, what activities in your daily life get affected by it?
Work. I'm a nurse. I work in a setting where I have to focus and pay attention for long periods of time, and I have a hard time doing that when I have headaches that last 2 hours.
Makes sense. All right. Any like sensitivity to light or noise?
Light makes it worse. Bright light.
Okay. All right. So before I go into like the purpose of the treatment and what we're going to be doing here today, I just gotta go through some questions to make sure you're eligible for the treatment. Do you have any personal history of cancer?
No.
Okay. Any cardiac conditions we should be aware of?
Mm-mm.
So when you're taking a shower, can you feel the difference between hot and cold water on your neck region?
Yes.
Yes? Okay. Any impaired circulation?
No.
Okay. Have you recently been ill with a fever?
No.
Do you have any sort of history of high blood pressure?
No.
Okay. Alright. So what we're going to be doing here today is called an occipital release. So the occiput is right on the back of the neck, like right below the base of the skull here.
Okay.
We're going to be looking to do a fascial release there. Do you know what fascia is?
Yes.
Okay. Alright, so fascia is like connective tissue that it's actually all throughout your body. I just have to explain it like you didn't know what it is. Covers your muscles, it covers your bones, it covers nerves as well. It's literally everywhere. So sometimes due to trauma, infection, immobilization, scarring, adhesions, maybe faulty posture, this can get that always happens. This can get tightened up and it's like it turns into like a little ball and can actually cause like movement disorders, pain, and just overall dysfunction. And it could also be the reason why you're having headaches as well. So what we're going to be doing here today is we're going to be looking for that fascial release, like I said. So what I'm going to do is, do it right now, but I'm going to lay you down. Your head will be right here for now. And I'm going to just give you a few warm-up massage strokes to get you used to my touch, get me used to it. And then for the actual treatment, I'll explain it as we go, just because it'll be easier. And we'll have a lot of time because it's going to take 90 to 120 seconds to engage the tissue, and then 3 to 5 minutes to actually cause the release.
Okay.
Okay. So before we begin, I have to give you the signs of what a fascial release will feel like. So you might feel a heat build up. You could feel a therapeutic pulse. I might be feeling these things as well. The thing that you will definitely feel, if you do feel it, will be a temporary increase in pain.
Okay.
It should only be a little bit. If it's a lot, then let me know and we'll stop. It should just be slight though if you do get it. You might feel my fingers sliding. That won't be my fingers moving. It'll actually be your tissues loosening because I'm not going to be moving my fingers.
Okay.
And then it could also be increased blood flow to the area. A little bit of skin can become a little red. And there could be like a softening sensation that I would be much more likely to feel. Do you have any questions before we begin?
No.
Alright. So I'm going to go ahead And I'll explain this as we go. So I'm gonna have you head right here. Alright. So I'm gonna do a quick Golgi tendon reflex. I'm gonna have you go ahead and take all the neck and trap muscles. I want you to tense them up for me for 5 seconds. 5, 4, 3, 2, 1. Now relax. Alright, very good. From here on out, all you have to do is just relax. Try to answer my questions. Don't nod your head or anything if I ask you a question, but just get your hair out of the way. Alright, so I'm gonna do some quick F-rod stroking. But yeah, from here on out, just try to short answers to the questions.
Okay.
And try not to nod your head or shake your head. So what I'm doing right here is just F-rod stroking, just getting warmed up. Getting the patient warmed up to my touch. Getting my fingers warmed up. And how's this feel?
Feels good.
Right. So this should be nice and relaxing. Just relax that neck for me. Alright. So now I'm going to begin the treatment. So I got your head while I explain this. So I'm going to do a little hook grip with my fingers. I'm going to find the occiput. And I'm going to use the weight of her head to apply my traction. So I'm pretty much just going to hold her for the traction part, 90, 120 seconds. Go ahead and start it now. Alright, relax that head. Very good. Alright. So I got the weight of her head on my fingers. Oh no, your phone locked. Yeah, get the watch for me. Thank you. Alright. So what I'm looking here is just applying traction to your muscle, to your occiput right now. So this is just static. I'm just using the weight of your head, resting on my fingertips. How does this feel right now?
Feels good.
Okay. Alright, there we go. Alright, so I'm looking to do this for 90 to 120 seconds. So at a minute on your watch, I'm going to start my traction, which is going to actually begin the release. So what I'm doing with the traction is I'm just applying slight downward pressure. I'm still using the weight of her head. It's not ideal, huh? You're good. Just keep tapping it occasionally to keep it on. I'll let you know if it goes off. Alright, so it's a minute. Alright, start the downward traction a little bit. How's that feel?
Feels
Alright. So you're good to just let it go for a while. It's not going to be this. So this next part is 3 to 5 minutes.
Okay.
So this is wherever we're actually looking for the fascial release. So 9:41. I'll just use the time on your watch. So at 44, if we have signs of release, we'll stop, okay?
Okay.
So what I'm doing here is to warm up your muscles. I use the heat of my fingers and the pressure of your neck and the weight of your head to help apply my traction. Now I'm just once again using the heat of my fingers and the weight of your head just to aid in the release. Not too much work going on. Really the only thing that's working is my fingers. I'm going to try to keep your head off of my palms. It's a little bit harder on the bed, uneven surface. The chair is less than ideal, but that's okay. How you feeling?
Good.
About a minute in. So I'm already starting to feel a little bit of increase in heat. Do you feel that?
Mm-hmm.
Okay. Remember, no head nodding. Yeah, it's weird. Still comfortable?
Yes. Yeah.
So here I'm just looking for more signs of release, whatever that may be. It could be feel a little bit of a pulsing sensation.
I feel that too.
It looks like we're getting a nice release here already. So we've already gotten the desired response, but I'm still gonna hold till at least 3 minutes. I'm sure you won't complain about that. I'll do a little patient education here while I'm waiting for the last minute. So a lot of times the headaches can be caused by tighter muscles in the neck and the head. So it could be caused by this fascia right here. It could be caused by tight muscles in the neck. It could be caused by tight muscles in the head. There's a neck massage. There's a head massage. There's also another fascial release technique on the head, which is a hair pull, which we're not doing any of those today. We're just doing the occipital release, but those are other options that we could try in the future. Yeah, I definitely feel a pulsing. You're good with the watch. So I definitely felt a little bit of slide, so whenever I take her out of this, you're just going to keep on relaxing for me.
Okay.
I'm going to slightly go up to where I started, nice and gentle. See how much my fingers moved?
Mm-hmm.
Yeah. Cradle the head. Alright, I'm going to set you down. Alright. So, whenever you get up properly, so you swing, get the feet up here. Alright. Now you prop up on that right elbow, swing your legs over, and you have to use that momentum. Very good.
That felt good.
Yeah. Alright. So, looks like our long-term goal for you is to report no headaches for 3 days by discharge. And it looks like your next appointment scheduled is Tuesday. Does that sound correct to you?
Sounds good.
Okay. Alright, so like I said, just hopefully that helps with the tight muscles in the area. Hopefully it helps relieve a little bit of those headache symptoms. If not, there's always more muscles we can work to help, hopefully get rid of these headaches.
All right.
Thank you for your time, Ms. Diver.
Thank you.